when it comes to addiction, there's only 2 studies that were ever done on NAD plus therapy for addiction. These are both from 1961 by the same author, not well-designed studies. One had 20 people, one had 104 people, no controlled randomized trial. This is not what I would expect if we were to, let's say, have a big movement of getting this therapy into a bunch of addiction clinics. I certainly would want to see more of a scientific base. And again, to me, the main concern is not even so much that it's dangerous per se. I don't necessarily think it is. I think it's, are we drawing attention away from things that we know are effective, like methadone, like buprenorphine? I would prefer our attention to be focused on expanding the number of providers who are offering those. We still have many, many counties in the US that don't have a single provider of those medications. That to me should be the number one priority right now.
Dr. Repass, why do you think there are so few studies surrounding NAD, even though it's been around for decades?
Yeah, because the way that we treat is ineffective anyway. Okay, so we're dealing with an ill-defined and ill-treated problem. Okay, if we had this problem defined properly, we would be focusing in on actually studying people while they're detoxing. We don't do that because it's extremely difficult to do that. This process takes 10 days. Even if we narrowed it down to 6 days, it's an enormous thing. How are we going to do a double placebo-controlled trial of this when you have, and it would be unethical of me to do it because I know that I see the people very before my eyes getting much better on the NAD, whereas on normal saline drip, nothing would be happening for them. I know this because I've treated people who I treated at another facility for detox with the standard methods, and they had a miserable time. And then I treat them with NAD, and it's like, it's night and day, the restoration of their function. I'm here to treat people. I'm here to restore their function, get them back. I want them to live. I appreciate all these studies with Suboxone. There's millions of dollars being spent on these pharmaceuticals because there's millions of dollars that are to be had. I hate to say it, but this is a fact. The money makes the world go round. Just because there's no money in NAD because it's universally available. People can access it. So there's nobody's going to make a windfall on this. This is a reality. What are we shooting for? What are our goals? What do we really want for this world? Do we want to just stop the hemorrhage, or do we want to say, wait a minute, maybe, just maybe, those intoxicants were a bad idea in the first place, and we shouldn't be poisoning our bodies with them, and we should be seeking the best for ourselves and our patients and our loved ones? Why is that not the question?
Well, I'm concerned with the way this messaging is being presented. On the one hand, Dr. Repass, you're mentioning that Suboxone helps a lot of people. On the other hand, if I interpreted it correctly, it sounds like you're calling it poison. And the problem is, again, we know that it cuts the death rate by 50%. So I'm concerned that viewers watching here might actually be dissuaded from taking the medication that we know works.
Suboxone is not exactly poison. It's a step down from things. I get it. I get why you're scared. I get why you're worried about this, but you're coming from the place of assuming hopelessness in addiction.
I actually don't think it's hopeless. I mean, I have interviewed dozens upon dozens of people whose lives have been changed, and not just by Suboxone, by methadone, by naltrexone, by other FDA-approved medications. And these are people who regained hope. They regained stability was actually the main thing. They stopped drug-seeking behaviors. They stopped their cravings. They stopped withdrawal symptoms. And they were able to reestablish a normal focus of their life back on their family, their friends, their jobs, employment, housing, and so forth. I actually don't see this as a hopeless option at all. I see this as a very hopeful option for people.
But you're relegating them to that. You're defining them as being ever needing of a substance like this, and that's not really freedom. That's not really.
But I would disagree, because there are many. And step out of the addiction world for a moment. I mean, I have to wear glasses daily. You know, this isn't somehow negatively defining me. People have to take antidepressants regularly, diabetes medications regularly. If it's working for them, if they are stabilized, if they are healthy, that's what's important.